talk to the people.
Magandang gabi sa inyong lahat. Nandito kami again to keep you updated na para malaman ninyo kung ano ang nangyayari at ano yung ginagawa at ano yung natatapos at ano yung hindi. Dito po yung mga departamento secretary and they will make the report to you. So, attending this meeting tonight, nandito po si Secretary Duque, Secretary Galvez, Secretary Lorenzana, and Secretary Anyo. Then we have a via video conference si Secretary Roque, si Secretary Nograles, si Chairman Abalos, pati si Vince Dizon who is in the United States right now. Other attendees are Secretary Medjaldia and Senator Bongo. Now, paano ba natin umpisan to? I'd like to report to you last week that nandun ako sa Marawi. We commemorated the 4th anniversary from the terrorist group, and we have also unveiled the marker for the grand mosques sa Marawi. Gusto ninyong tignan ang Marawi ngayon, let's try to ask the technical people if they have the footages.
Marawi City was considered the economic hub of Lanao del Sur. Consisting of 96 barangays, it is the only city in the province and lone Islamic city in the country. It is also known to be the home of the colorful culture and traditions of Maranaos. However, on May 23, 2017, a firefight broke out between the military forces and members of the ISIS-inspired Maute terrorist group in Barangay Basak, Malutlot. Several attacks were also made by the terrorist group in some parts of the city as diversionary tactics. Dubbed as the longest urban warfare in the history of the country, the siege left dozens killed, property and infrastructures destroyed, and civilians of the city facing the aftermath of the destruction. After 5 months of firefight, government troops crushed terrorist Maute group and restored freedom and peace in the city.
Ladies and gentlemen, I hereby declare Marawi City liberated from the terrorist influence that marks the beginning of rehabilitation of the city.
The liberation signaled the return of normalcy in the city. President Rodrigo Roa Duterte established the task force Bangon Marawi to spearhead the recovery, reconstruction, and rehabilitation of the war-torn city. 56 government agencies joined forces to ensure rapid response to the needs of citizens affected by the crisis. TFBM began rehabilitation efforts by providing emergency assistance like financial, livelihood, food, medicine, and shelter. TFBM then transitioned to the second phase, which is debris management or the removal of millions of tons of debris brought about by the siege, as well as in recovering and detonating unexploded bombs. The third phase of the rehabilitation is the construction of vertical and horizontal infrastructure, which went on full blast in July last year amid the COVID-19 pandemic.
akala kasi namin yung pamigay na bahay, mga scam lang yan. Parang hindi totoo ba? Parang hindi kami talaga naniniwala na may bibigay sa amin yung mga bahay namin. Kaya laki ng pasasalamat namin, laki ng tuwa namin kasi kumbaga yung nasira namin ng mga bahay, ito napalitan na siya.
Sobrang ding pasalamat namin kay Presidente Duterte kasi marami siyang naitulong sa amin. Yung gawain, agad-agad na natatapos.
Nagpapasalamat po kami sa Task Force Bangon Marawi, sa NHA, sa UN Habitat, DTI, DSWD, kay Presidente Duterte po. Sila po yung may magandang loob na tumulong sa amin.
The national government through TFBM, along with the local government units of Marawi, Lanao del Sur, and Barm, are committed to complete the rehabilitation of Marawi within the term of President Duterte.
Task Force Bangon Marawi, with the local government unit, Marawi City, and the provincial government, we are together to ensure that the rehabilitation will be undertaken smoothly, and I can assure you that it will be completed within the term of the President.
I will see to it that Marawi will rise as a prosperous city again. let us be clear on this. We in government, executives, executive department, cabinet member, si Secretary De Rosario said, we do not claim any credit for this. To rebuild Marawi was a government commitment and trabahante lang kami. So, except for, well, yung magpapasalamat sa akin, hindi, okay na rin pero hindi na kailangan, sabi ko, kasi trabaho ko yan. And besides, hindi ito sa kampanya kasi we are in the campaign period already na hindi ito pera ng tao ito. So, kaya nandito kami in this program because sinabi ko sa inyo, ipapakita ko kung saan yung pera ninyo napunta. Napakita na namin yung sa mga airports, highways, and everything. And of course, the greatest damage inflicted by the siege, primarily started by the terrorists, left Marawi into rubble. So, pinakita ko sa inyo kung saan ang pera natin napunta. Importante kasi yan. Kasi ngayon, left and right, may makita lang korupsyon, nandito, korupsyon. Yeah, magandang issue kasi yan kasi election. Yung hindi naman nakaalam masyado o walang alam o alangan yung alam, tapos sumali kayo sa hindi ninyo alam ang proseso. Now you see the light of day. At the first instance we have said, the Senate is not a criminal investigation body. We are looking for graft, hindi dyan, sa ombudsman. It's the prosecutors who will pour over the documents and would tell you that there is a good case to file in court. Otherwise, sabihin sa iyo, i-dismiss natin yan kasi walang ebidensya. But there are some people who keep on hammering that is free campaign exposure. Pero sinabi ko sa inyo, alam ko na, mga tao na may dalawa ang muka dito sa ating gobyerno. Sabihin ko lang maya. Ang good news natin muna sa pediatric vaccination. I am happy to report that on the first day of inoculation of the minors last October 15, more than 1,100 minors with comorbidities have been given their first dose of vaccine against COVID-19. Also, we will expand the vaccination of this adolescent age group of 12 to 17 by adding 13 more hospitals in the NCR. Currently, we have an initial 8 participating hospitals, and we hope to expand this number ng mga hospital, and we also will welcome the arrival of additional vaccines in the coming days. Ang dating ng vaccine kasi continuous. Kaya araw-araw halos si Secretary Galvez, pati Secretary Doke, tumatakbo talaga yan doon sa para to be there yung i-discarga yung mga vaccines natin. That is why I said I want them to focus on their work. Kung wala na ako namang tanungin sa kanila at huwag pabalik-balikin. Kung wala akong I said you can crumple, tear and tatter sa walang pakialam dyan sa formalin. Ang akin yung tao. So, yun ang nangyari dyan. As of October 18, we have received more than 191.5 million COVID-19 vaccine doses. We expect this number to reach a total of 104 million doses by the end of the October. Tapos meron tayong vaccines donations. We thank the Japanese government for their donation of close to 2 million doses of life-saving vaccines. Indeed, Japan is a friend closer than a brother, ready to help in times of need. Our thanks go also to the United States for providing more than 2 million doses of COVID-19 vaccines delivered through the facility called COVAX. This is the 7th shipment of vaccines from the United States, totaling approximately 18 million doses of vaccines. These vaccines deliveries demonstrate the strength of the U.S.-Philippine alliance. The deliveries also demonstrate the wisdom of the Philippines' decision to do its part in contributing to the COVAX facility and strengthening its engagement with the United Nations and the World Health Organization. The vaccines will benefit our country and help us bring closer to the goal of having a better Christmas. We have also administered close to 53 million doses as of today. Naturo ka na. 32% of our target population have been fully vaccinated, and we are well on our way of achieving our target of at least 50%. We are confident that if not all, we are confident that most, if not all, cities in the country will be hit and even surpass the target before Christmas. In the NCR, more than 80% of the population are fully vaccinated. Yan, napakaganda niyan na balita. This is not just for your own protection, but also for the civic duty to protect others and also allow to turn the page and get everyone back to track of normalcy. So medyo dumadive yung nahawa. Wala nang mahawaan kasi may bakuna eh. By the way, let me just talk to you about itong bakuna. Until now, early on, unang mga araw, wala pa tayong bakuna, nag-warning na ako sa inyo. Na kasi may mga tao, may grupo ng tao, may sektor dito na gusto Moderna, gusto Pfizer, gusto US, ayaw ng made in China. When after all, they're all done in the laboratories with people who are really well-equipped medically to do the job. So sabi ko, huwag kayong mamili. Ngayon, mayroon na naman na gusto ayaw magpa-deliver ng iba, kung hindi Pfizer pati Moderna. Sinasabi ko sa iyo, kung hindi totoo yung mga bakuna na itong sa Sinovac pati Sinopharm, ito yung unang nagdating, eh di marami ng patay. If they are not effective, if they are not good, bakit ngayon halos wala ng patay? And yet you continue to mingle, ignoring the rule of distancing at every opportunity. Kung ako Sinovac, natanggal ko yung ano. Pero hanggang ngayon, hindi lang siguro panahon ko, anywhere I go, tatanggal ako ng, kasi ayaw ko magsalita na may muffled, para kang aso na nilagyan ng anti-kagat. Bunga nga. Hindi ako makapagsalita. So yun yung ang maiwan ko sa inyo. Huwag kayong mamili. Sabi ko kay Secretary Galvez pati ibabalasan ninyo. Yung isang karton, itapon mo sa isa dito. So ang magdating sa inyo halo. Kaya ang mga advice ko naman kung nakikinig yung mga medical people sa gobyerno, yung do not do some favoritism there. Kasi masisira talaga. You will just spoil everything. For the good news, again, yung FedEx is the largest logistics company in the world. Has returned to the country in Clark after leaving Subic for China in 2009. Umalis dito sa Clark. Dahil rin siguro kay Gordon. FedEx constructed a brand new 17 square meter world-class facility in Clark that features state-of-the-art cold storage facilities capable of shipping and storing sensitive cargo like vaccines. Ipakita ng meron kayong footage doon para makita ng how Clark is doing now. That's Clark. Wag lang sana pasukin ni Gordon. Yun. Pinakamalaking Let's go to the report of the individual secretaries about their department and their work. And call on Secretary Galvez first. Go ahead, sir.
Mr. President, Senator Bongo, yes, Rebing Bong Delvia, fellow secretaries, sa lahat po ng ating mga nanonood at nakikinig, magandang gabi po sa inyo lahat. Ibabalita ko lang po ang mga magandang nangyayari po this coming October as the President has narrated. Yung iba po na hindi po na sabi po, I will emphasize po. Next slide, please. Sir, marami pong magandang balita po sa October. It's the biggest supply delivery from Pfizer, Moderna, and COVAX and Sputnik. As we have said earlier, almost 92 million doses already been delivered. For COVAX, ito po ang isa sa pinakamalaking delivery ng COVAX, considering that for this month, they have already delivered 7.3 million, which is 6.4 po ang Pfizer from US donation and 844,800 from the German donation. The German ambassador told us that they will add more to make it 1.6 million AstraZeneca donation, and also based on the text given to us by ES, that another 2 million will be given by the US to make it more or less 18 million for the COVAX. For this month, we already received 20 million that already arrived. This is the biggest arrival since most of our vaccines that we received last month is only 19 million. So the achieving of 100 million doses delivery before the end of October is on track. And right now, the supply is not anymore an issue. We have more than 38 million doses in our warehouses. Next slide, please. As we have discussed earlier, that more or less 53 million doses with more than 28 million people have taken their first dose, and 24.5 million Filipinos are now fully vaccinated. This represents a total of 31.76% of the target population and 22.23% of the total population. NCR is now 80% fully vaccinated, and more or less 93% have already received the first dose. We would like to congratulate the Chairman Abalos and all the NCR mayors for the job well done. Talagang napakalaki po ang nagawa po ng NCR, at ito po ay isang hemplo para makita po ng mga ibang regions. Other regions are now catching up with the delivery of more vaccines to the provinces. In fact, tumawag po sa akin si Congresswoman Gomez na yung yung Ormoc is already 90% first dose. At baka makuha na rin po nila yung tinatawag natin na capacity ng NCR, and they're very happy that we are providing supply to this city. We are now raising the daily target to 1.5 million a day in order to achieve a happy Christmas this year. We will be opening the general population, then the pilot of children vaccination. And we are ramping up the vaccination of students, teachers, and tourism personnel, OFWs, and seafarers. In fact, si Madam Berna po, si Sec Berna po, Mr. President, pumunta po siya pupunta po siya, umiikot po siya sa lahat ng mga tourism spot. At nagsabi nga po siya sa akin noong last Monday, pumunta po siya sa Dipolog at saka po doon sa Camiguin Island. And ang maganda rin po, yung ating mahal na sekretary na si Secretary Prospero Popoy de Vera, talagang napakasipag niya po na talagang mag-vaccinate ng mga student, teachers, at saka po bumibisita po siya sa mga different universities. Bukas po pupunta po kami sa isang university at magpapakuna po kami ng more or less na mga 3,000 po, Mr. President. Next slide, please. Third, the COVAX delivery, we would like to thank WHO and also the COVAX facility and UNICEF that the delivery of COVAX now is very significant. It already accounted for 24.3 million doses, and majority of which are coming from the US donation. Total na po ng US natin ngayon 16 plus yung promise po na additional 18, and other countries are expected to donate this October. So Mr. President, as you have instructed to us, we need to strategize to increase the daily jobs and achieve people protection soon as possible time, particularly in key economic regions. So yung instruction niyo po na yung mga cities po, unahin po natin. And mag-mobilize po kami nila Sec Beans, ni Sec Duque, at saka si Sec Anyo, para po talaga mag-mobilize po natin ang ating mga LGUs, ang ating armed forces, ang ating police, and ating DOH regional offices. So ito po, we will comply to you. Na we will be venturing to have really a daily job of 1.5 million. And then napaka-successful po ng ating pilot children vaccination in 8 hospitals. Sa report po na sinabi po ni Yusek Bergere, sa 1,500 children with comorbidities, with only 4 minor usual, meron po tayong tinatawag na usual side effects, yung very minor. So nakikita po namin na pwede na po tayo mag-expand to the different hospitals. And also, we can accelerate the vaccination of children to support the opening of the classes and economic recovery. Kasi ang po natin, ang ating pong isa sa mga targets is to really sustain and open our schools. Next slide, please. So, kung makikita natin, compare po natin yung ating accomplishment for the month of October. Kung September 18 po, ito lang po ang nakuha nating bakuna. This is basically, lang po, mga 59 million. So, makikita po natin na isang buwan, meron po tayong 32 million na natanggap, so naging 91.5 million na po tayo. And ganoon din po, natutuwa po tayo yung COVAX dati, ano lang po ito, 14 million, ngayon 24 million, so nag-add po tayo ng 10 million. Ganoon din po yung ating vaccination, yung ating na-administered, only po 41 million lang po nung September 18. Ngayon po nadagdagan ng 11 million. Ito po ang medyo magandang datos po, Mr. President. Makikita po natin ang ating future performance na yung 50 million for the end of the year, kayang-kaya po natin dahil kasi yung difference po ng 31 at saka yung 23, more or less ano po yan, almost 8%. So kung 3 months po tayo, 24% po yan. So magiging 55% po ang makukuha po natin dito sa ating fully vaccinated. So yun po ang inano po namin na sana makuha po namin yung 51% or higher than 51%. Next slide please. So ito po yung yung ating update ng vaccination administration by region. So makikita po natin na ang target na population po ng NCR is 9.7. Makita po natin na 9 million na po ang nakakuha ng first dose. Meaning ibig sabihin yung hesitancy ng NCR napakababa. Nakita natin na halos 93% na po ang ating percentage ng first dose. At the same time, yung fully vaccinated, almost 81% na po. At more or less 7.8 million ang lahat na fully vaccinated ng NCR. Again, we would like to thank the Chairman Abalos and also the NCR mayors for job well done. Nakikita po natin yung CAR, yung CAR po, meron na rin pong 34%. At yung iba po humahabol na rin po, lalo na yung nasa green colored green. So makita po natin na unti-unti po humahabol po sila from a measly 18% during the previous month po natin. Next slide please. Pero ito po yung problema po natin. Makikita po natin yung talagang problema dahil kasi itong nakikita natin, ito yung tinatawag na trifecta of supply, throughput and demand. Noong dati po, Mr. President, supply po ang problema po natin. Ngayon po, ang problema po natin yung throughput. Kung paano po natin i-administer yung mga vaccine. Next slide please. So kung makikita po natin, noong March at saka po noong September, supply-driven po tayo. Meaning, ibig sabihin, dahil kakulangan po ng supply, mababa po ang throughput natin. So ngayon po, sir, ang problema sir natin na dito, itong sasolve po natin ngayon. Kasi ang ating, yung sinasabi nyo nga po, na marami tayong naka-stockpile na more or less 39 million na vaccine. So ina-address na po natin yung logistical challenge at the regional, provincial, and municipal deployment and administration because napansin po namin na ang deployment bago po makarating po sa vaccination site, maabot po ng more or less to 7 to 9 days. So ito po ang sinosolving po namin ni Sec Beans, Sec Duque, at saka po ni Sec Anyo, kung paano po mapapibilis yung ating deployment from the national warehouse down to the administration site. Ito rin po ang problema po ng ibang mga cities na nababangga na po yung tinatawag nating hesitation. So ang gagawin po nila is magsusweeping po sila house to house and then barangay to barangay. Ito po yung magiging parang ano po natin na yung willingness po, tataas po yan. Pagka nagkaroon po tayo ng tinatawag na bandwagon effect na pagka nagkaroon tayo po ng tumataas na po yung ating willingness. Dahil po, tuloy-tuloy po yung paalala niyo po sa ating mga mamayan na kailangan po natin mag-vaccinate because this is the only way that we can get to the new normal. So nandito na po tayo, Mr. President. Natapos na po tayo sa supply-driven, nandito na po tayo sa logistics and throughput-driven. And then later on, makikita po natin pagka nandito na po tayo sa 80%, yung demand generation to get the 100% of vaccination. So next slide please. Pero ito po yung nakakaroon po tayo ng series of meeting with the different private sector. Ang private sector po, Mr. President, they are more than willing to help us. Actually, sir, si CABSEC, siya po ang nag-organize po ng mga tinatawag natin sa Makati Business Club at saka po yung tinatawag nating Economic Forum at saka po yung T3. Nag-meeting po kami ng series of meetings. Ito po yung recommendation po nila para po makatulong po sa ating tinatawag na mag-increase po ang ating job per day. So yung first po sir nila, proposal, is yung box to max. Ibig sabihin, kailangan po natin na talagang we have to vaccinate all the willings. Kumbaga sa ano, hindi na po sequential, i-widen na po natin yung tatawag natin, yung sinasabi nyo nga po kung sino po ang gustong magbabaksin, ay magpabakuna na po. And then yung ito po, itong pinag-usapan po namin ni Sec Anyo, nabigyan po natin ng incentives yung mga nagpapabaksinate. Kasi po nakikita po natin na parang nangyayari po is parang pare-pareho po yung mga incentives para sa mga nagba-vaccinate. Ibig sabihin pagka nag-vaccinate po, sila lang po ang pwedeng lumabas. Sila po ang tinatawag natin na sila yung pwedeng mag-dine in at pwede rin po mag-travel at saka po walang restrictions. Ganun po ang ginagawa ng Israel na yung mga unvaccinated, every week po, sinuswab po sila at yung pag-swab po is yung expense ay doon po charge din po sa mga tao. So yun ang parang ginagawa natin na tinatawag natin na itong mga yung mga vaccination mandates, meaning it will entice most of our unvaccinated to be vaccinated. And then marami po silang ni-recommend, pati po yung resettlement metrics for NCR and high vaccination LGUs, yung reopen transport further, reopen school further, at saka po yung strengthen yung healthcare system by having a public-private task force to address the constraints of the healthcare system, especially yung payments po ng PhilHealth. And then they are recommending also, considering that information is the only determinant for decision making, kailangan meron po tayo ng pinaka-robust na tinatawag nating data ecosystem. And we would like to recommend for the appointment of a data science. And then with this, ang ginawa po namin, yung ating future ops, in-integrate po natin, isinama po natin sa ating tinatawag po na recalibration of our strategy. Next slide, please. Ito na po yung tinatawag natin incorporating all the recommendations of the private sector. Ito na po ang gagawin po natin. One strategy, number one, is vaccinating the unvaccinated. Meaning, number one, we will ramp up the vaccination to achieve 1.5 million jobs per day. Then we will concentrate on vaccinating the willing to achieve a bandwagon effect. Then we will open up general population and pediatric vaccination, and we will still maintain focus on senior and other priority sectors. And the number two strategy is further protecting the vaccinated and healthcare system, meaning we will have the public-private task force to address challenges and issues on PhilHealth, maintaining masking and provide safe environment and ventilation on the community and also on the workplace, and then also prepare for revaccination or third dosing for the healthcare workers and the vulnerable sector. Ito po, pinag-prepare na po namin ni Sec. Tuque dahil nagbigay na po ng inclination ng WHO na yung ating vaccination for the third dosing, considering that maglalapse na po yung natawag nating yung immunity. Ito po ang inano po natin na maybe we can start by November or maybe early December. And then we will open up schools and keep our students and teachers safe. So we will implement a safe, phased, sequential, and monitored pediatric vaccination, and then we will vaccinate at schools and universities so that all the schools and universities will be considered as safe area. And then we will vaccinate teachers, students, and personnel. Then in protecting the economy, the fourth strategy, the economy, we will use the focus and expand. So meaning we will accelerate the vaccination of key cities and economic hubs. And then second, we will level up Region 4A and Region 3 to NCR, meaning we will designate NCR, Region 3 and Region 4A as one ecosystem or one geographic area. And then at the same time that Region 10, 11, and 12, and Region 6 and Region 7 will be considered also as one ecosystem or one geographical area. And then also, number three is the strict implementation of mass transport and workplace protocols, and also stringent work discipline, masking, social distancing, and good ventilation. And then lastly, is to achieve a safe Christmas and national election. So our objective is to vaccinate at least 50 million of priority population before Christmas. And then all the NCR 10, the key cities, at least 70% fully vaccinated before Christmas. And also vaccinate at least 70% of the total population before the election period. So meaning before February, on the election period, we already vaccinated more or less 70%. Next slide, please. So this will be our way forward, meaning our future operations. While the cases are continuously decreasing and our economy is slowly opening, we need to prepare for another surge or prevent same from happening. And we can only do this by striving to achieve the max to the max, meaning we have to protect the centers of gravity, the schools and the universities. Then second is to regenerate our healthcare workers and frontlining, meaning kailangan po natin maipahinga ng konti yung ating mga healthcare workers. At the same time, we have to create another surge in preparation for another surge. And then third, we have to reorganize and reconstitute our hospitals to strengthen further our healthcare system. Number four, to protect our seniors and children, and also to improve ventilation and minimum health standard enforcement at workplace. That's all for my report, Mr. President. Maraming salamat po.
Thank you. And we have Secretary Duque.
Good evening, Mr. President, and magandang gabi kay Senator Bongo, E.S. Medi Aldea, sa mga kapwa ko, cabinet members, at higit sa lahat ng ating pong mga kababayan. Ang aking pong report ay may tatlong bahagi. Unang-una ay yung ating pong maikling ulat ukol sa Typhoon Marine Response na susundan ng ating usual COVID-19 updates. Bilang panimula, Mr. President, nais namin kayong bahaginan sa ginawa natin pagtugon sa Bagyong Maring as of October 19, 2021. Meron higit 200,000 pamilya o higit 800,000 individual ang naapektuhan sa 1,592 barangay sa Regions 1, 2, and CAR. At sa bilang na ito, meron po tayong 543 na pamilya o 2,084 na individual ang nananatili sa 61 evacuation centers sa mga rehiyon. Meron 6 na sira na mga health facilities na agad natin natugunan at nakapagpadala po tayo ng siyam na Health Emergency Response Teams or HERTS sa Ilocos Sur, Nara, Palawan at CHD-8 upang mapibilis ang medical and emergency response operation sa mga lugar na ito. At meron na rin halos 8.5 million worth of health commodities gaya ng mga gamot at mga COVID-19 related supplies na preposition ng ating mga CHDs o regional offices upang magamit sa ating response operations. At patuloy lamang ang ating ugnayan sa ating mga Centers for Health Development at local health units concerned upang makapagpaabot ng nararapat na serbisyo sa mga apektadong pamilya sa mga lugar na aking pong nabanggit. Next slide. Dito naman po para sa ating usual COVID-19 updates. Ngayon pong ika-19 ng Oktubre, ay may nadagdag na 4,496 na bagong kaso. Ito po ay mas mababa doon sa nakaraan na 2 araw na mga 6,000 plus. Noong October 15 ay nasa 7,000 tayo. So nakita natin ito po ay tuloy-tuloy ang pagbaba. At sa ngayon po, yung ating 4,496 na naidagdag na mga kaso, 741 po ay mula sa National Capital Region. At 465 naman mula po sa Region 2 and 254 mula sa Region 4A. At ang mga pangunahing lugar na nakapag-ambag ng mataas na mga kaso, ang Negros Oriental 211, ang Cagayan 182, ang Zamboanga 155. Para naman sa ating mga aktibong kaso, ang bilang ngayon, ika-19 ng Oktubre ay nasa 63,637 at ito po ay nakatumbas 2.33% of all cases at ito po ang isa sa pinakamababa natin na naitala na mga aktibong kaso. Samantala, ang ating pong recoveries ay umabot na sa 2.6 million thereabouts. no? Representing 96.17%. At ang atin naman mga pumanaw ay na idagdag na 211. Ang pangkalahatan natin na bilang ay 40,972. Ang katumbas po nito ay 1.5% case fatality rate. At next, ito naman pong patuloy, makikita natin ang confirmed COVID-19 cases by adjusted date of onset. Ito pong atin 4-week moving average. Ito po yung black line. Makikita po natin ang nag-peak po tayo sometime in September. Ayan po, pinakamataas natin, 20,948. Pero after that, nagsimula na bumaba ang mga kaso. In fact, ngayon po, October 13 to October 19, ito po yung ang naitala po na average daily cases ay nasa 6,955, which is 31% lower than the previous week or prior to this week from October 6 to October 12, na kung saan ang atin pong 7-day moving average of 10,065 daily cases. At from here, galing po rito ay nasa 20% po ang ibinaba at ito po 31% ang ibinaba. So ito naman po yung atin mga representative regions na may mga pinakamataas na mga kaso. So sa madalit salita, Mr. President, talagang ito malinaw na nag-umpisa na talagang patuloy ang pagbaba ng mga kaso. Next slide. Ito naman po yung ating mga confirmed cases. Ito po yung mga iba't ibang mga epidemic curves ng mga iba't ibang major island groups. Yung pong kulay blue, ito po ang NCR. Nakita natin na una na siyang nagpakita ng malaking pagbaba ng mga kaso after the surge sometime in mid-September. Sumunod po ang rest of Luzon. Medyo nahuli po ang pagbaba ng rest of Luzon. At sumunod naman din po rito yung atin plus areas of Bulacan, Rizal, Laguna, Cavite. At nakita po natin ito naman ang Mindanao, yung kulay orange na epidemic curve. Bumaba na rin po. Ganun din naman ang Kabisayaan. Nag-umpisa na rin po bumaba ang mga kaso. So, all in all, nakikita po natin the evidence that our cases have truly started to go down. No? Next slide. Ang healthcare worker benefits as of October 19 at 16 billion na ang atin na ipamahaging benepisyo, pangkalahatan para sa ating po mga healthcare workers at kasama rito ang pinakabagong ulat ng ating pamamahagi ng special risk allowance at COVID-19 sickness and death compensation. At kumpara sa amin huling talaan no October 11, tumaas ng bahagya ang pondong na ibaba para sa special risk allowance ng healthcare workers na kabilang sa batches 3 and 4. Ang naipamahagi na nasa humigit kumulang na 55,000 healthcare workers ay nasa 735 million pesos na po at mula sa huling ulat na 617 million pesos. Para naman sa sickness and death compensation, mula sa 604 million, nasa 613 million ang atin na naipamahagi para sa mga healthcare workers na nagkaroon ng mild, moderate, at severe to critical na kaso ng COVID-19. Kasama rin dito ang mga benepisyaryo ng mga nasawing healthcare workers dahil po sa COVID-19. So, ang amin pong tanggapan ay patuloy na humihiling ng karagdagan na pondo para sa ating po mga healthcare workers na hindi pa nakatatanggap ng kanilang benepisyo. At nais din namin na ipaalam na kami po ay magpapatuloy sa pagtulong sa ating pong mga namamayaning healthcare workers na araw-araw lumalaban para po sa atin mga kababayan. So ito lamang po, next slide, ang pinakahuling ulat, ang bilang pagbubuod ay Nakikita po natin ang patuloy na pagbagsak ng mga kaso natin at ang pinupuntirya natin ay patuloy na palakasin, palawigin ang tugon, lalo na sa mga maliliit na rehiyon na kung saan ay nakita natin mabagal pa rin ang pagbagsak ng kanilang mga kaso at ang utilization rate ay nagbabanta pa rin na posibleng sumipa pa ito ng high risk utilization rate. Ano po? At pangalawang pagbubuod ang atin pong bakunahan sa A2 and A3 priority groups ay dapat pong isulong pa rin ito sa mga iba't ibang rehiyon at para makatulong sa atin pong full coverage. At ito po ay magkakaroon ng pinakamagandang epekto pagdating po sa pag-iwas na mabilaukan ang ating healthcare system sa capacity at mapababa ang ating healthcare utilization rates and deaths. So ito na lang po ang akin pong huling bahagi ng pag-uulat at handa po akong sumagot sa inyo pong mga katanungan. Salamat po, Mr. President.
Thank you, Secretary Doki. May I call now on Secretary Lorenzana.
Magandang gabi, Mr. President. Magandang gabi, mga kapwa ko, Lingkod Bayan. Mr. President, ito po yung aming report ng Crisis Management, Crisis Action Plan Implementation na pinapatupad ng ating National Task Force on COVID. Next slide, please. Ito po yung ating mga ginawa nitong nakaraang linggo sa tracing and isolation. Meron po tayong 12,370. Suspected cases ay confirmed cases ay 6,453. Close contact trace, 47,813. Yung po ating mga contact tracers ay medyo bumaba ang bilang dahil yung pong kontrata ng mga 20,000 contact tracers ay natapos na. Ito naman sa ating COVID test natin ay meron tayong na mula nung mag-umpisa yung ating crisis management ay 751,000 na yung ating na testing. Ang total natin ngayon kabuuan po mula nung mag-umpisa tayo ay 20,865,838. Next slide, please. Ito po magandang numero dahil bumaba po yung ating occupancy rate. Ibig sabihin na 22% na lang kabuuan nito ang ating may occupied ng ating mga may cases. Kaya dumami po yung ating mga bakanting beds. Next slide. Next slide, please. Patuloy po rin nating pinapatubad yung minimum public health standards sa itong nakaraang linggo ay nakahuli sila ng violators, 361,470. Yun namang mga hindi pinalusot sa sick points ay 16,342. Saka yung mga hindi dapat lumalabas ng bahay ay 1,725. Next slide. Ito po yung health facility subcluster. Ito naman yung bilang ng mga hospital beds na nakalaan sa ICU at saka sa mga COVID beds. Ngayon po ay bumaba ng 57% na yung weekly healthcare utilization rate na binanggit na kayo na ni Secretary Doke. Pero ito po yung magandang numero ngayon. Halos kalahati na lang ang occupancy rate ng ating mga hospital beds ng COVID. Kaya nga po yung mga ibang hospital ay nagbabawas na ng COVID wards at COVID beds. Kukunti na lang po yung nagpapa-hospital. Next slide, please. Ito po yung numero ng napakaano po. This is clear na itong mga hindi vaccinated ay sila yung mga nandoon sa ICU beds, ICU wards, at saka yung intubated, yung pong meron ng tubo na nakasaksak sa lalamunan, ay sila yung mga hindi vaccinated. Kaya po siguro ito magiging natin, halimbawa natin sa mga taong ayaw pa magpabakuna na dapat sila mapabakunahan na. Ito naman po sa ating mga health workers nating hinahire ay 96% na of the 10,026 ang nakuha na natin. Next slide please. Ito naman sa border subcluster ay merong 37,391 OFWs quarantine. Positivity rate of ROFs. Ito ba yung mga returning overseas Filipinos na bumabalik? Ito lang, nag-decrease yung kanilang positivity from 1.75% to 1.48%. Maganda pong gauge ito ng kung gaano katindi yung ating pag-testing ng mga COVID. 16,701 naman ROF saka foreigners ang ating asistihan. Ito naman yung 80,025 quarantine rooms for ROFs. Marami po yung ating quarantine rooms, 80,025 na quarantine rooms for ROFs, returning Filipinos, sa NCR, Clark, Cebu, Davao. Marami po yan. And Subic, at ang kanila occupancy rate ay 79%. Yun naman sa airport, meron tayong 1,198 isolation rooms para po sa mga dumarating na kailangan i-isolate with a 40% occupancy rate. Next slide please. Ito yung mga dumarating ng mga natin, mga OFWs, 1,805 ang seafarers assisted, 9,352 returning overseas Filipinos via repatriation, at saka 9,000 through 66 Benihan flights. Sa balik probinsya naman, Mr. President, meron tayong na-assistihang 7,510 sa NAIA na pabalik sa kanilang probinsya, at saka 6,599 ang nabigyan ng free rides in PITX.
Thank you. Go now to Secretary Anyo.
Magandang gabi po, Mr. President, Executive Secretary Salvador Medaldea, Senator Bongo, fellow public servants, mga kababayan ko, magandang gabi. Unang-unang pong iuulat ko ay ang nagaganap na bigayan na ayuda sa probinsya ng Bataan. Ito na lamang po ang natitirang probinsya matapos makatapos ang NCR at ang probinsya ng Laguna. So nakita po natin 99.01% or total of 691,364 beneficiaries na po ang nakatanggap. At ito na po ang huling linggo ng palugit na ibibigay natin sa Bataan para tapusin ang pagbibigay ng ayuda. Next slide please. Ito po makikita ang breakdown ng pagbibigay ng ayuda sa lahat ng municipalities ng Bataan. Next slide. Dito naman po sa ulat natin sa kampanya against illegal drugs. Makikita po na nakapagtala tayo ng 933 operations at nagkaroon po ng pagka-aresto sa 1,331. 16 naman po ang nag-surrender at 8 ang namatay sa anti-drug operations. Gusto ko lang pong bigyan ng pansin ng dalawang insidente. Ang isa ay naganap noong 16 October, 3:30 p.m. sa Aguinaldo Highway, Dasmariñas, Cavite, kung saan ang pinagsanib na pwersa ng PIDEA, PNP, AFP, NICA at Bureau of Customs ay nakapag-conduct ng buy-bust operations na nakapag-aresto ng 2 drug pusher at naka-confiscate ng 240 kilos worth of shabu. Naghahalaga po ng 1.65 billion pesos. At noong pong 18 October naman, 10 a.m. sa Punta Verde Subdivision, Pulong Kakutod, Angeles City. The same din pong grupo ng ating mga operators ang nakapag-conduct ng bypass operation. 4 na Chinese national ang nasawi at nakapag-kumpiska ng 38 kilos worth 262 million pesos worth of Cebu. Kaya makikita po natin, sa loob lamang po ng isang linggo, 2 billion, 11 million, 570,419 pesos worth of Cebu ang ating nakumpiska. May tuturing po na isa ito sa pinakamalaking accomplishment ng ating mga law enforcers. Next slide. Ito naman po ang talaan ng mga violations na na-record natin sa dumaang isang linggo. Ayan po ang not wearing face mask, 92,000. Mass gathering, 1,582. At no physical distancing sa 51,000. Mr. President, nais ko rin pong ibalita at paalalahanan na sa nalalapit nating eleksyon ay pinag-uutos natin at pinagbabawal sa ating mga kandidato ang pagbibigay ng tulong pinansyal, material o politikal na suporta sa CPP, NPA, NDF at mga kaalyado o kasabing organisasyon ito. Kabilang na rin ang Abu Sayyaf Group, Bangsamoro Freedom Fighters at iba pa. Ang pagbabayad ng permit to campaign o permit to win sa mga teroristang ito ay katumbas ng pagsuporta sa kanilang illegal na gawain at masasabing hangarin. Mahigit itong pinagbabawal sa ilalim ng ating batas. Dito po sa Section 4 of RA 10168, the Terrorism Financing Prevention and Suppression Act of 2012, ay pwede pong patawan ng reclusion temporal hanggang reclusion perpetua o kaya ay magkakaroon ng fine na mula 500,000 to 1 million pesos sa mga lalabag sa batas. At ito rin po ay pinagbabawal sa Section 261 ng Omnibus Election Code of the Philippines na po pwede pong maglatag ng parusa 1 to 6 years imprisonment at disqualification to any public office. Nakahanda po ang DILG na magsampa ng kaso upang i-disqualify ang mga kandidatong mapapatunayang nagbabayad o nagbibigay ng anumang uri ng suporta sa mga teroristang grupo oras na magsimula ang ating campaign period sa 2022 election, lalong-lalo na po sa CPP, NPA, NDF. Next slide. Sa paggunita naman po ng UNDAS ngayong November 1, ang IATF ay naglabas na ng guidelines na ipasasara ang lahat ng sementeryo, memorial parks, libingan kasama na columbaria mula October 29 hanggang November 2, 2021. Ang ating mga kababayan ay maaaring bumisita sa mga nasabing lugar anumang araw maliban sa nasabing panahon. Nakadagda din sa 30% capacity ang papayagan sa loob ng mga sementeryo at kailangang sumunod sa minimum public health standards. Ito ay ipatutupad ng ating mga LGUs ng Philippine National Police kasama ang mga barangay tanod, barangay public safety officers at mga auxiliary units. Kinakailangan din magpasa ng ordinansa or executive order ng mga LGUs upang ito ay maipatupad ng maayos upang maging ligtas ang ating mga kababayan sa paggunita ng darating na UNDAS. Yan lamang po, Mr. President. Maraming salamat po.
Thank you. Now to Secretary Roque.
Juwad, magandang gabi po, Mayor. Magandang gabi po kay Executive Secretary Medialdea at kay Senator Bongo at sa lahat po ng kasama natin na nanunungkulan sa gobyerno. Well, ang ulat ko po ngayon ay pinalawig po natin yung ating pilot para sa alert level system. At ito po ay i-implement din natin sa ilang mga rehiyon sa iba't ibang parte ng Pilipinas. So kabahagi pa rin po ito ng pilot study at hindi pa po ito talaga permanente. No? Pero sa ngayon po, linagay po natin sa alert level 4 ang Region 7, Negros Oriental, ang Region 11, Davao Oriental. Nasa ilalim naman po ng alert level 3 ang Region 4A, Cavite, Laguna, Rizal, Region 7, Siquijor, at Region 11, Davao City, Davao del Norte. Nasa ilalim po ng alert level 2 naman po ang Region 4A, Batangas, Quezon Province, Lucena, city. No? Sa Region 7 po, Bohol, Cebu City, Lapu-Lapu City, Mandaue City, Cebu Province ay nasa Alert Level 2 rin. Kasama po sa Region 9 ay ang mga probinsya ng Davao de Oro, Davao del Sur, Davao Oriental. Ang Alert Level 1 po ay ito po ay reserve po at ina-amend po natin yung ating mga matrix na dapat bago ma-Alert Level 1 meron na pong 70% ng populasyon ng A2 at A3 at ang eligible population ang nabakunahan na. Pagkatapos po nito ay nandito po yung ating classification para sa ibang lugar na hindi pa po kabahagi ng alert level system. So nasa ilalim po ng MECQ mula 16 hanggang 31 of October ang mga lugar ng Apayao, Kalinga, Batanes, Bulacan, Bataan, Naga City sa Luzon at saka ang syudad ng Zamboanga City at ang probinsya ng Zamboanga del Norte sa Mindanao. Nasa ilalim naman po ng GCQ with heightened restrictions sa Luzon po ang mga probinsya ng Abra, ang Baguio City, ang Ilocos Sur, ang Pangasinan, ang Cagayan, ang Isabela, ang City of Santiago, ang Nueva Vizcaya at ang Quirino. Sa Visayas po, nasa ilalim din ng GCQ with heightened restrictions ang Bacolod City at ang Capiz. Sa Mindanao po, kabahagi po ng GCQ with heightened restrictions ang Zamboanga del Sur, Misamis Oriental, Cagayan de Oro City, Butuan City, Surigao del Sur. Mapapasa ilalim naman po sa GCQ. Sa Luzon po ay ang mga probinsya ng Ilocos Norte, ang Dagupan City, ang Ifugao, ang Benguet, ang Tarlac, ang Occidental Mindoro, ang Oriental Mindoro, ang Puerto Princesa City, ang Marinduque, Albay, Camarines Norte. Sa Visayas po, mapapasa sa ilalim na po ng GCQ ang Aklan, Antique, Guimaras, Negros Occidental, Iloilo City, Iloilo Province, Tacloban City. At sa Mindanao po, kabahagi po sa GCQ ang Zamboanga Sibugay, ang Misamis Occidental, ang Iligan City, General Santos City, Sultan Kudarat, Sarangani, North Cotabato, South Cotabato, Agusan del Norte, Agusan del Sur, Surigao del Norte, Dinagat Islands, Cotabato City at Lanao del Sur. Ang mga lugar na hindi po natin nabanggit, lahat po sila ay mapapasailalim po sa MGCQ. Next slide please. So yun lang po ngayon ang ating marireport sa ating taumbayan at maraming salamat Mayor at sa lahat ng ating mga kasama.
Salamat, Secretary Roque. We're going to call Secretary Nograles to make his report.
May adlaw, Mr. President, Senator Bongo, ES Medialdea, and ang ating mga kaubanan sa gabinete, mga kababayan. Ang report ko po ay tungkol naman sa Commission on Filipino Overseas or CFO na alam naman po natin ay nasa ilalim po ng Office of the President. Yung CFO, Mr. President, mandated under Batas Pambansa Bilang 79 para ma-promote and uphold yung interest, rights, and welfare ng overseas Filipinos. Pero ang emphasis po ng services ng CFO para po sa mga Filipino immigrants, ito po yung mga Filipino permanent migrants abroad, mga permanent residents abroad ng mga Filipinos, mga naturalized in other countries, those who hold dual citizenship, Filipino spouses and other partners of foreign nationals, descendants of overseas Filipino youth overseas, exchange visitor program participants, and Filipino au pair participants. Ito po yung coverage ng CFO. Sa contribution naman ng CFO to our government's pandemic response, actually patuloy naman ang trabaho ng CFO at they undertook several initiatives dito sa pagtugon sa pandemic ng COVID-19, and they ensured its continuous delivery of services. But they were also able to realize savings ng 10.2 million pesos, which kinontribute naman po ng CFO to the pandemic response last year. Amidst the pandemic, ay committed pa rin ang CFO to its mantra na kalidad na serbisyo para sa mamamayan abot sa labas ng bayan. Next slide. Nag-facilitate din po ang CFO office from 2016 to 2020 ng mga donations 174.59 million pesos worth of donations in financial donations and in-kind or material donations channeled through the Lingkod sa Kapwa Pilipino or Link Appeal at nakapag-benefit ng more than 265,000 sa pamamagitan ng mga small-scale at high-impact projects for social and economic development needs. Kabilang po dito yung mga medical missions, calamity relief assistance, classroom construction, scholarship grants, and skills training and skills transfer. Next slide. At malaki rin po yung ambag ng CFO Office sa war against human trafficking bilang miyembro ng Interagency Council Against Trafficking or IACAT at chair ng Advocacy and Communications Committee ng nasabing council. They continue to operate itong 1343 action line. Ito po yung National Hotline Against Human Trafficking na nagbibigay po ng mga emergency response at tumutugon sa mga crisis calls from victims of human trafficking and their families. In fact, almost 250 cases mula sa hotline na ito ay na-handle po ng commission. May hinanda po na video presentation ng CFO para mas lalo nating ma-appreciate ang accomplishments po nila. If we can play the video of the Commission on Filipino Overseas.
The Commission on Filipinos Overseas, or CFO, is an agency under the Office of President created through Batas Pambansa 79 in 1990 to uphold the interests, rights, and welfare of overseas Filipinos and strengthen their ties with the motherland. To ensure the welfare and protection of Filipino migrants on the issues and realities of migration, the CFO registers and provides pre-departure orientation and services to outbound Filipinos and their families who hold permanent resident visas abroad, our spouses, partners, or fiancés of foreign nationals, J1 visa or exchange of visitor program participants, and Filipino au pairs to Europe. The Commission has developed online registration services as an adjustment to the new normal brought on by the COVID-19 pandemic. To strengthen overseas Filipinos' ties with Philippines, the CFO engages them as partners of nation building even while abroad through social development programs and services that benefit local communities and families left behind. The Commission serves crucial roles in interagency efforts, such as the Interagency Council Against Trafficking, the Interagency Committee on Philippine Schools Overseas, and the Interagency Committee on the celebration of the Month of Overseas Filipino. The Commission is proud of several awards and citations in performing its duties, among them its ISO certification, the Prime HRM Bronze Award from the Civil Service Commission, and 2 unqualified ratings from the Commission on Audit, highest rating possible for government agencies. To continuously provide quality service to the public, the CFO constantly improves its pool of talent and professionals and lives by its policy statement, kalidad de serbisyo para sa mamamayan, abot sa labas ng bayan.
Yun lang po, Mr. President. Maraming salamat po.
Thank you. Well, I guess we're all through with our resource persons now. Wala nang magre-report. So I will just say a few words about itong Blue Ribbon Committee hearing. We welcome the call of the Philippine College of Physicians that this matter should be immediately given to our courts and the Ombudsman. We have been saying this for the longest time, and we all know that the Senate cannot prosecute. Mabuti pa ang mga doktor. Alam at naintindihan nila. File cases is the right way to go. Stop using this issue in aid of election. election. Problema kasi sa Senate natin, trying hard maghanap ng mga issue na may nangungurakot o kaya may nakakapera. But up to now, the committee has not really built a case out of the numerous hearings they have conducted. And so we go back now to what has been established many times. Walang overpricing, legal at naging ang proseso legal ang naging proseso ng pagbili according to what has been provided by Bayanihan 1, na-deliver lahat at binayaran lang pagkatapos na-deliver. And if you think that you have identified companies with tax issues, then file the appropriate cases. Matagal na naman namin sinasabi, kasuhan nyo ang mga dapat kasuhan. Lahat naman talaga dapat magbayad ng buwis. At kung kailangan magbayad, singilan para magbayad yung may mga atraso sa gobyerno. Kagaya ni Senator Gordon, you have not even taken steps to deliver the 86 million. And so I think we will have to see if we can call on the ombudsman to step in because matagal itong utang na ito at final and executory na. So bakit kung senador ang may tama, walang nagagawa at ilang taon na to. So, itong mga senador, siguro, they are exempted from the operation of the law. Because until now, this 86 million, which was incurred during sa termino ni Gordon sa Subic, itong incessant and repetitive summons at wala man sana kung patawag ninyo at you can grill them all day long as long as it is relevant, pertinent and all, sige. Pero kung paupuin ninyo ng ilang oras na hindi naman tatawagin and day to day yung summons, you call my memorandum stupid? Well, I challenge you. Bring your arguments to the proper court and I will answer you. You threaten the budget of different agencies of the executive because the officials refuse to attend to your hearings. Ito yung mga pang-abuso talaga itong masabi ko sa gobyerno pag demokrasya. Itong separation of powers, co-equal and everything. And they threaten to paralyze government. I challenge you, do it. Pag kayong mga hearing, reduce the budget by 1/3. Hinahamon ko kayo. Gawin ninyo yan. Mautak mo kaya kayo. Kaya ako, ordinaryo lang, 75. Pero kaya ng utak ninyo, sige. I challenge you. Yung tatakot ninyo, mga sekretary. Anong sakit ng, ang sekretary, kaso lang itong, you are before gentlemen. Tignan mo, sigaw-sigawan mo yan, makita nyo balang araw, it will come to a head. And then it would not be good for everybody in this republic. Tignan mo, subukan mo. Reduce it by 1/3. I challenge you. Huwag kang magtakot, gawin mo. o zero i-budget mo ang Office of the President. Sige nga, gawin mo daw. Bakit? Abot ba yung pera ninyo kung hindi magdaan sa akin? Kung hindi ako mag-release, tit for tat, kala nyo kayo lang marunong. Alam mo dito sa gobyerno, suplado, takutan, Gordon, Sus Mariusep ka. Yeah. Know where you come from. At alamin naman ninyo kung saan kami galing. Kumakain kami ng atay doon sa amin. Ito lang. Tanungin mo yung mga military. Yung mga doon, kinakain. Iyo takutan lang eh. Walang takutan, diretso mo na. Let's have a showdown. Sige. Mamahusay naman kayo sa mga threatening. Let's have a confrontation para tapos na yung hangin mo. Kita mo ngayon, umalis ka na doon sa SBMA. Maganda na ang takbo. Ang hangin doon, wala nang paminsan-minsan na lang. Kasi wala ka na. Puro hangin ka lang eh. So yung mga kababayan ko, tingnan ninyo itong mga abusado na akala ninyo, mga Diyos sila. Threatening. Kaya itong mga reminders na, we're encouraging developments in our vaccinations as the number of new cases. We are hopeful that this will be the end of this pandemic in this country soonest. Pero wag pa rin yung kumpiyansa, mag-ingat. Maski na pa paano sinabi na sa inyo noon, mask, hugas, iwas, at labanan ang virus ng bakuna at huwag mamimili. Ang sinabi ko kay Secretary Galvez, haluin lahat. Ihalo yung karton por karton, o dito itapon isa, o sa dito na. Wag kayong mamili kasi talagang ito namang lahat bakuna. Okay to. I mean, they're all with, Ngayon, kung subukan ninyo, ayaw ninyo ng bakuna, anti-rabies, marami akong stock dyan ngayon. Pag may rabies epidemic doon sa lugar ninyo, di yun na lang ipadala ko. Ayaw ninyo ng bakuna ng huwag kayong mamili. Kasi sinabi ko, lahat yan may visa. Ayaw ninyo ng mga China. Ngayon gusto ninyo China farm kasi nag-China farm kaming lahat dito. Kami nga ang huli. No, alam mo kung ang bakuna hindi effective. Do you know that if these vaccines that we have been giving to the population are not really effective and right? Marami nang patay ngayon. We've been trying really hard to fight itong sa COVID program. Nakatutok kami lahat dito. And I'd like to thank everybody who have really contributed to what we are now seeing. Hindi ko magsabi success, but what you see now. At itong ating roko sa mga senador, okay mo lang yan. Basta do not overstep. Malaman mo man kasi. Ako na naman ako gago na. Kaya kasabi ko noon continuation. Sabi ko nga kay Secretary Galvez pati kay Secretary Dog, sige magbalik kayo doon kasi nakaumpisa na kayo. Yung pag-sign ko ng memorandum. Pero kung gano'n man lang, gano'n sigaw-sigawan ninyo o paupuin ninyo ng ilang oras tapos pauwiin ninyo ni isang tanong wala, anak ng kung gawain ko sa inyo yan, hindi lang ninyo alam kung paano, pero kung gawain ko sa inyo yan, maligaya kayo. Mga kababayan ko, dito tayo sa kampo ng tama. Huwag kayo doon sa kampo ng mali. Pag sabihin ko sa inyo, lalo na sabihin ko sa iyo, mamili kayo ng bagong mga opisyal, senador, basta yung bago. Hindi naman kailangan, wala talaga hindi sa gobyerno. There might be government officials, past or present. But try to scout new faces. Pabalik-balik sus Mario. Kay Gordon. Anong nakuha ninyo kay Gordon? Di pidap. Pati mukha niya nilagay sa ambulansa. Mabuti sana yung may-ari ng mukha na yan, isakay sa ambulansya. Maraming salamat po. Sige na kayo ng mukha.